The reforms we seek would bring greater competition, choice, savings, and inefficiencies to our healthcare system.
Barack Obama is continuing to lie and to put pressure on Congress to pass his health care reform bill. On Monday, Barack Obama held a conference call with liberal bloggers, and within that phone call, once again, he tried to claim that President Bush and the previous administration is entirely responsible for the present deficit. He claims that he has not added a penny to it. And as we all know, that is simply not true. As I pointed out in my previous videos on Obama's health care plan, that he, in fact, promised that he would never sign any bill that contained pork. And then he proceeded to sign the porkulous bill, which contained nothing but pork and did absolutely nothing to stimulate the economy. So that's approximately the first 3.5 minutes of the phone call. And then a blogger got on there and he asked Barack Obama about an article that he saw on Investors Business Daily. It didn't take long for us to run into an uh-oh moment when reading the House's Health Cares for All Americans bill. Right there on page 16 is a provision making individual private medical insurance illegal. When we first saw the paragraph Tuesday, just after the 1,018-page document was released, we thought we surely must be misreading it. So we sought help from the House and Ways and Means Committee. And it turns out we were right. The provision would indeed outlaw individual private coverage. Under the Orwellian header of protecting the choice to keep current coverage, the limitation on new enrollment section of the bill clearly states, except as provided in this paragraph, the individual health insurance issuer offering such coverage does not enroll any individual in such coverage if the first effective date of the coverage is on or after the first day of the year that the legislation becomes law. So you can keep your coverage just as Obama promised, with of course exceptions. Those who have private individual coverage won't be able to change it, nor will those who leave a company to work for themselves be free to buy individual plans from a private carrier. At approximately 3.5 minutes into the recording, which I've edited for you here, you will hear a blogger ask Barack Obama about this particular point. And if you listen carefully in the background, you will hear Obama laughing. And then he will admit that he doesn't know about this passage in the bill. Either he's lying or he truly doesn't know that this is in the bill. Either way, it puts him in a poor light. Here he's asking bloggers to write articles urging people to call their congressman and pass this bill, and all the while he doesn't know what is in the bill. Here's the recording, and there's also links on the right-hand side which will take you to the full recording, which is 24 minutes long if you care to listen to it, as well as a link to the IBT article, and I'll also put a link there to the bill so you can look it up on page 16 yourself and see that it certainly does say this. Thanks for listening.
Thanks so much for being on, and I want to just make a couple of quick comments. I want to leave about 15 minutes for questions to me directly, and then David Axelrod, my senior advisor, as well as Nancy Ann DeParle, who's my chief member of my healthcare brain trust, will stay on, and she can answer some additional calls afterwards. This is a critical time for us who care deeply about changing the healthcare system and how it's currently working. We are closer to reform than we've ever been. Of course, that that means the special interests and some of their representatives in Congress are going to pull out everything they have to stop it. I want to make sure that all of you and your readers hear from me directly and others on my team about what's going on. I know that there's been a lot of focus from a lot of people on keeping the bill strong, and that continues to be a key focus for me as well. But there's also a primary point that can't be lost. The status quo is unacceptable. You've got 46 million people without health insurance. You've got premiums going up 3 times faster than wages, out-of-pocket costs skyrocketing. So people who would defend doing nothing, I think, are defending the indefensible. So far, those who oppose reform have offered no meaningful alternatives. And one of the things that I know the blogs are best at is debunking myths that can slip through a lot of the traditional media outlets and a lot of the conventional wisdom. And that's why you're going to play such an important role in our success in the weeks and months to come. For example, the idea that the legislation I sign is going to be a source of record deficits is simply not true. It's a myth that's been spread by the same people that were responsible for record deficits over the last 8 years, a deficit that I inherited. And now we've got folks going out there saying that somehow that should be an excuse for inaction when it comes to health care. I've explained from the very beginning that this legislation has to be funded over the course of the next 10 years, and I've talked about the fact that 2/3 of the funding are going to come from ending unwarranted giveaways, hundreds of billions of dollars to insurance companies and the Medicare and Medicaid system, and other changes that reallocate tax dollars that are already into the system and spending those dollars in a more intelligent way. So that's just an example of the kind of change in the debate that so many of you can drive, and I think that's absolutely critical. I also think it's important just to keep the pressure on members of Congress, because what happens is there is a default position of inertia here in Washington, and pushing against that, making sure that people feel that the desperation that ordinary families are feeling all across the country every day when they're worrying about whether they can pay their premiums or not, or how to deal with a loss of insurance when they lose their job. People have to feel that in a visceral way, and you guys can help deliver that better than just about everybody. So I appreciate you guys being on. Jesse, why don't you tell me who's going to be the first caller?
And Gerald Wynant from True Blue, please go ahead.
Yes, thank you for taking my call, Mr. President. I know you were here in February. We invite you back to visit Maine in the summer.
Maine is gorgeous all the time, but I got to admit that when it's warm, I like it better. I grew up in Hawaii. What can I tell you?
Exactly. I've been running into the same quote from an opinion piece from Investors Business Daily, where they're saying that H.R. 3200 will make individual private medical insurance illegal, and they actually quote from Section 102 of the bill, which is grandfathering existing policies. Is this true? Will people be able to keep their insurance, and will insurers be able to write new policies even though H.R. 3200 is passed?
You know, I have to say that I am not familiar with the provision you're talking about. Let me just speak for the Obama administration. I have committed myself consistently to a very simple proposition. If you have health insurance and you like it, and you have a doctor that you like, then you can keep it, period. And I won't sign a bill that somehow would make it tougher for people to keep their health insurance. I want to make it more affordable and easier for them to keep their health insurance. And that's exactly why reform is so necessary right now, because if current trends continue, more and more people are going to lose their health care. At minimum, more and more people are going to be paying more money for their health care. And so we certainly would not be signing a bill that somehow prevented somebody from getting insurance that they've already got, or allow private insurers to sign up new folks if they're providing good service.